Hello, Dr. Hill, back again, another video, and I am stoked about this topic. It's a big passion of mine. I got a lot of friends and family that struggle with it, and a lot of the times, patients don't even know it's an issue. That's why I love talking about it. And what is it? It's sleep. I love to sleep. It's a fantastic thing to do. Helps reset the body, makes me feel good, I feel energized, I feel great. But there's a lot of people out there that have no idea that they got major sleep issues going on. Good news, we got ways to fix it. Why the hell is a dentist talking about sleep? Well, personally, I'm super passionate about it, but I can change people's lives. I can extend their life. I can get them off medications. We can do all sorts of stuff like that now with proper sleep, proper diagnosis, and proper treatment. Sleep apnea, people have heard about. Literally, patients or people stop breathing. I'm sure at some point you've seen those videos where patients are asleep or people are asleep, and all of a sudden they jerk up and they catch their breath and they big gasp. Well, that's because they stopped breathing for a certain amount of time and their body is waking them up on their own that they need oxygen. The body thrives off of oxygen. Okay, you got your airway right in this area. Okay, in your mouth you have your tongue, you have all that soft tissue. Well, one battle we're never going to beat is gravity. So as you lay down, that airway is going to shrink. That tongue and that soft tissue are going to help take over that airway. So you go from having a nice garden hose, as I always call it, a nice garden hose, to literally coming down and getting a coffee stir. Imagine doing that every night of your life. People snore. People have major issues. It's a problem, okay? There's ways to fix it, and I am telling you, you can change your life with that. Why is sleep such an issue? Well, it literally affects every day. I don't know if you remember in school, but they talk about a whole REM sleep. If patients don't get to that or people don't get to that, it's a major issue. And the problem with sleep, it's a snowball effect. Okay, so if you are not sleeping well this year and it continues on to next year, it's going to get worse and it's going to get worse and it's going to get worse. And the big problem with it that people don't understand is poor sleep can cause systemic, medical, real issues. Heart issues is a big one for me. Okay, I got heart issues in my family. If we lower the oxygen in your body, your heart has to work harder. Patients can end up having high blood pressure. They can end up over time having heart attacks because their muscle's been working so hard for so long for undiagnosed issues. It will over time cause fogginess of the brain. You heard me talk about the REM sleep earlier. If you don't get to that REM sleep and have a minute to relax and have your brain be able to shut down, get all that memory and that storage and all those gigabytes going on and stuff, you're going to continue or forget things that you shouldn't forget. And a lot of times people think, oh, it's just old age and stuff like that. Well, nowadays we're kind of learning some more things where it might be something that we can kind of help, we can postpone, and we can kind of really figure it out. Okay? I ask my patients usually the same questions. In the morning when you wake up, do you feel rested? A lot of the times it's, no, I could sleep some more. I'm not really ready to get up until I have my coffee an hour later or something like that. And I'm not talking about when you're out at 3 a.m. and you wake up at 6 and you do all that. No, I'm talking about a consistent basis. I ask them the question of, do you feel rested in the afternoon? At 2:30 or 3 p.m., do you need that venti Starbucks? Do you need a jolt of something? Do you need a Monster Energy drink? Do you need something on a regular, consistent basis? Or another one that's a great one, let's say I'm in Columbus, great example. I drive to Cleveland, okay? Love Cleveland sports, by the way. Brownies, Super Bowl champs, some point in my life. Pray. I drive to Cleveland. Am I getting tired on that trip? For no reason. It's in the middle of the day. I shouldn't be tired driving an hour and a half, 2 hours to Cleveland. But if I do, that could be a possible issue. And then the infamous thing is, does your partner tell you snore? And you could potentially be causing yourself interrupted sleep the whole time where your body never gets that full recovery. I scared you to death with the sleep issues. Wasn't the point. The point was to make you understand that it's okay to have this conversation. Primary physicians, phenomenal. There's sleep doctors out there. That's all they do. That's it. They focus on that. A lot of dentists are starting to jump into it. You're dealing with the muscles. You're dealing with the jaw, the airway, the head and neck region, which is kind of our wheelhouse, which we understand. We know the anatomy, things like that. Now, you've seen those commercials, the So Clean, to clean your CPAP and do all that kind of stuff. CPAP is amazing. It is the gold standard to help patients that have moderate to severe sleep apnea. The problem with that, patients aren't very compliant. It doesn't travel well. Patients don't like wearing it. The partners of the patients don't like hearing the noise. It's hard for patients to be very compliant on those things. Now, hear me out. A CPAP is the gold standard. If you can do a CPAP and you have major sleep issues, you wear it, you rock it with pride. Your days will be better, I promise you. But nowadays, okay, there's something that's called an oral sleep appliance. We do oral sleep appliances. I do oral sleep appliances all the time for my patients now. An oral sleep appliance, if you imagine, in simple terms, it's a retainer on the top and a retainer on the bottom. What they end up doing is the way that it's fabricated and the way that we make it is we're actually trying to hold your lower jaw forward as you lay down to go to bed. We're not pulling your jaw out. We're not doing anything like that. We're trying to help you get a better position for your airway to stay open. It is literally that easy. It is that simple. You can obviously tell I'm passionate about it. I get riled up about it. Something as simple as sleep that patients don't really think much about, and how much it changes your life and changes the game. It's a big deal to me. That right now, and the reason this video was made, is so that you can start that conversation. It is a real conversation. There is real ways to help now and make life so much better for you, you don't even realize, okay? So any of those symptoms are coming your way, okay? You literally ask your dentist, bring it up to your primary care physician, look for someone, Google somebody in your area that knows what they're talking about with sleep. I promise you it'll be worth it, and I promise you the benefits that you get are going to be mind-blowing. If you have questions and you can't find somebody for that, comment right here. Send them straight to me. I promise you I will get back to you. I am a nerd when it comes to sleep. I think it is fascinating, the benefits and or the problems that come with it. I think it's great now that we have all this technology, the science, the history, the research, that we can help fix it. Comment to me, message me directly. I promise I will get back to you, or find somebody in your area so that you can have that conversation, okay? Like, subscribe. I can't wait to talk more. Obviously, you can tell sleep's my passion. Speaking of that, I cannot wait to sleep tonight. It's been a long week. See you guys soon.